Hi, I'm Dr. WaiKoNi and welcome to Bright Star Baby and Child Clinic. This is part 3 of the vaccine series, and in this video, I would like to talk about our current hot topic, which is the COVID vaccine. Now, with the raging pandemic, our best chance at fighting it would be to have a vaccine to protect us. Thankfully, a COVID vaccine is now available and will be coming to our shores very soon, and it is developed at a record-breaking speed. Sure, there are still many questions waiting to be answered, but let's focus on the important questions that we already have the answers for. Let's not spread any unfounded stories about the COVID vaccine and focus on what we do know currently. Now, will the COVID-19 vaccine work? Yes, so far, studies have shown very promising results and that the COVID-19 vaccine is 95% effective in preventing the disease. Now, why should one get the vaccine? Getting this vaccine prevents one from getting the COVID-19 infection in the first place, and it also reduces the risk of one having a serious disease or dying from the disease even if one does get it. It also decreases the chances of one spreading the virus to another. What is herd immunity? When 70 to 90% of the population are vaccinated, the disease will be unable to spread. The hope is that we achieve herd immunity with this vaccine, but this will likely take some time. Some may wonder, isn't the COVID vaccine developed too quickly? Is it safe to use? I want everyone to know that scientists have been studying the coronaviruses since the early 2000s when SARS broke out. The vaccine's technology has also been in study for the past 30 years. Also, the worldwide joint effort in helping to develop a vaccine, plus the significant technological advances and resources that we currently have compared to the past, contributed to the speed with which this vaccine was developed. It's true that the timeline has been accelerated, but all the crucial steps were taken to ensure that this vaccine is safe, and it went through all the trials and phases necessary to produce this vaccine. All the crucial safety steps have been maintained and the highest standards of safety ensured. In short, this vaccine is safe. What are the side effects of the COVID vaccine? Now, there is no such thing as zero risk or zero side effects as with all things medicine. And it is also true for this vaccine as well. And it's also true for many other vaccines that are already in the market for a long time. Many vaccines, including the COVID-19 vaccine, may have some mild and short-term side effects, such as pain at the injection site, fever, fatigue, or a headache. This is normal. It means that the immune response is kicking in. But however safe a vaccine is, there are bound to be some people who might be allergic to it or have some serious reactions to it. But these events are very, very rare. Can children get the vaccine? For now, for example, the Pfizer-BioNTech vaccine is only available for those 16 years old and above, but pediatric trials are on the way. If I have already been infected with the COVID-19 infection, can I still get the vaccine? As we currently do not have sufficient data to know for sure how long the protection is after one gets the infection, it is recommended that those who have gotten the COVID-19 infection in the past should still get the vaccine. In addition, we have seen some people who get infected more than once with the COVID-19 infection. This may mean that these people may not be fully protected after getting the first infection. Do I still have to practice social distancing or wear masks after I get the vaccine? Well, no vaccine is 100% effective, and we are still learning more and more about the COVID vaccine every day. So, meanwhile, yes, do continue to practice social distancing, wear masks when necessary, and avoid crowded places. Similarly to getting other vaccines, for example, flu vaccine or measles vaccine, would you willingly expose yourself to others that are infected with measles or influenza, even though you've already gotten the vaccines yourself? Not likely. So we must continue to practice our SOPs diligently until herd immunity is achieved. Now, once I am fully vaccinated, am I able to pass the virus on to others? This is still being studied. The Moderna vaccines as well as the Oxford AstraZeneca vaccine looked at the asymptomatic transmission of the virus post-vaccination and found that it was significantly decreased with their vaccines. However, we do know that not everyone responds to the vaccine well. Some vaccinated people still may get infected and not have symptoms. Those people can still spread the disease to others. The bottom line is, until we reach herd immunity or we get more data on this, we still need to practice our SOPs in the meantime. Is the COVID vaccine a live vaccine? None of the vaccines in development so far are live vaccines. So if you obtain these vaccines, the COVID vaccines, you will not be able to pass the COVID infection to others. Are there any human or animal parts in the vaccine? The mRNA vaccine does not contain any human or animal parts in them. What if someone is in the high-risk medical group or are immunosuppressed? Are they able to get the vaccine, or is it recommended for them to get the vaccine? Yes, absolutely. The US CDC is absolutely recommending that people in the high-risk medical groups, or if they are immunosuppressed, to get this vaccine. And because this is not a live vaccine and it doesn't enter the nucleus of the cell, these patients are actually encouraged to get the COVID vaccine because it is better to get the vaccine than being infected with COVID-19. Can pregnant women or breastfeeding mothers take this vaccine? Pregnant women were not included in the trials, but they are allowed the option of taking the vaccine. Preliminary studies show no effects on reproductive health. Many pregnant women opted to get the vaccine when it was released, and so far, no major side effects have been reported. We do not currently have any data on breastfeeding mothers. So in summary, the COVID vaccine seems to have a very good safety profile, and I actually cannot wait to receive the vaccine. I have already registered myself and my clinic staff to receive the vaccine, and we hope that we can protect ourselves as well as those around us. Thank you very much for watching. Meanwhile, stay safe and take care. Bye everyone.